Hi, I'm Dr. Edwin Williams. I'm a New York-based rhinoplasty specialist, and I've had almost 25 years of experience with rhinoplasty. It's my practice. The question that I'm asked a lot by our patients is, will my breathing get better or worse after rhinoplasty? And is there a reason to have rhinoplasty to fix your breathing? Now, I would say probably a third of our patients have significant breathing issues so that they do have their nose addressed with rhinoplasty. In fact, there are a number of patients that I've seen over the years that will say to me, I probably wouldn't be here if I didn't have a breathing problem, but my nose has always bothered me a little bit, and so it would make good sense to do that at the same time. Typically, we're talking about a few different situations. Someone who either has a deviated nasal septum, or someone maybe who has broken their nose in the past, or someone who's been seen by an ear, nose, and throat specialist and told they have a nasal valve collapse. In other words, when they breathe in, it collapses on one side, or both sides for that matter, and they probably should be fixed. It's important to be able to breathe through your nose. As we get older, it becomes a health hazard with things like sleep apnea. It's tough on your heart. It's not good for your blood pressure. So one question people will often ask me and have over the years is this something that's covered by insurance? What I will tell you is that the traditional insurance plans will cover issues as they relate to function and breathing, but they will not cover cosmetic type issues with rhinoplasty. So what we will often do as a courtesy to patients is provide them the paperwork for the deviated nasal septum and that kind of thing. We're very, very honest with insurance companies, and we're not going to bend the rules or try to put something through that's not legitimate. But we will provide the CPT codes if someone is interested in having that done, and we do a lot of that, having patients that we fix. My primary background is I'm double boarded. I'm boarded in ear, nose, and throat head neck surgery, and then I went on and did a facial plastic and reconstructive surgery fellowship 23 years ago, and that's why I'm very passionate about rhinoplasty and rebuilding noses, and it's just one of the things that I enjoy doing. Our current approach, and this is why I think it's so important to rhinoplasty, is what I call a structural reorientation. Years ago, people used to take out too much tissue, try to thin the nose, try to take the bump down too much. And really what we find is that a well-balanced nose is a nose that looks smaller. So what we try to do is we want to make sure that there's enough structure and form in conjunction with a very nice aesthetically pleasing natural nose so that the individual can breathe. It's very important that people look balanced and natural, but also important that they breathe. Because of my specialty in being a rhinoplasty, someone who focuses on rhinoplasty, we do unfortunately do a lot of redo or revision work where someone has done too much. Maybe it's a doctor who is a little inexperienced, or maybe it's someone who had their surgery done years ago when doctors tended to take too much tissue out. How do I repair that? The way I repair it is, the first thing is if I have some cartilage, I use some cartilage from their septum to help rebuild some form to make them aesthetically pleasing, or even ear cartilage if I have to. And there are a number of patients that I end up having to use rib cartilage because they've had either too much structure. You can get on our website and you can check out some of the revision surgeries where I've had to use rib cartilage to repair and improve someone's breathing. So in conclusion, breathing and getting a nose that works after rhinoplasty is very, very important. Sometimes rhinoplasty is a matter of just a deviated septum and getting a valve repaired. Our current approach, as I mentioned, is much more of, we use the endonasal or closed, or what some people refer to as the scarless approach to rhinoplasty. I think it's a lot less invasive than the incision that goes on the base of the nose. And certainly if you have any other questions, we do have, let me see if we have a book that is available actually as a download, a PDF download on our website, but is also available on Amazon, and all proceeds of this go to domestic violence. So I hope you found this video useful. Thank you for taking your time.